Hi students, welcome home to Mars. Today we shall discuss about clinical correlation of midline structures of the neck. Please watch my previous video on anatomy of midline structures for a better understanding. Moving on to clinical correlation. Assume you get two patients. One, a small child with a midline swelling over here, somewhere in the upper part of the neck, and a second patient with difficulty in breathing, a trauma patient. Now, both have problems in the midline. Now, how do we apply our anatomical knowledge to differentiate the swelling and to manage breathlessness? So, we have two things now. One, a midline swelling, and second, tracheostomy. Now, what can be the midline swelling? It can be either thyroglossal cyst, or it can be a thyroid gland swelling. You can call this as goiter, or some other swelling like lymph node enlargement. Now, how shall we differentiate a thyroglossal cyst from a thyroid gland swelling or goiter? First, let us discuss thyroglossal cyst. Now, before we start with differentiating thyroglossal cyst from thyroid gland swelling, I just want you to demonstrate on yourself what happens when you swallow. Just keep your hand over here. That means you're literally keeping your hands on the larynx. Now, take a glass of water, sip it, swallow it. Now, when you swallow, can you feel your larynx moving? Now, why does this happen, and how does it help you to differentiate thyroglossal cyst from thyroid gland swelling? Let us start with thyroglossal cyst. The development of the thyroid gland starts somewhere called as foramen cecum on the dorsal surface of our tongue. Now, where is this foramen cecum? It lies between the anterior 2/3 and posterior 1/3 of the tongue. From this depression, what we call it as foramen cecum, a temporary tubular structure develops, and that structure is called as thyroglossal duct. This thyroglossal duct starts migrating from the tongue to the lower part of our neck, where the thyroid gland will eventually develop. Let us see what happens next. So, the thyroglossal duct begins at the level of foramen cecum, descends down in front of the hyoid bone, the thyroid cartilage, the cricoid, and ends here at the level of the development of the thyroid gland in the lower part of the neck. This thyroglossal duct has to disappear. But sometimes this duct persists, and when it persists, small cyst develops in that thyroglossal duct at the level of hyoid bone, or at the level of the tongue, or at the level of lower part of hyoid bone, or at the level of thyroid cartilage. This is called as thyroglossal cyst. Thyroglossal cyst. So, it is very obvious from the development that these cysts are connected to the tongue. So, how to differentiate if there is a midline swelling over here? Just ask a patient to protrude the tongue. like this. When a patient protrudes the tongue, because of its connection to the tongue, a thyroglossal cyst will move. This is very characteristic. It also moves when a patient swallows because of its attachment to the laryngeal cartilages. Whereas a thyroid gland swelling will move during swallowing but may not move while protruding the tongue. Why this happens, let us explain. So we can see here the thyroid gland. This is the isthmus which lies in front of trachea, and these are the two lobes which extend till the thyroid cartilage. So this is your thyroid gland lying in front and sides of the trachea. So this picture, what you're seeing now, this is the side view where you can see part of thyroid gland, you can see hyoid bone here, thyroid cartilage here, cricoid cartilage here, and the tracheal rings over here. Now the question is, why does thyroid gland move up and down during swallowing? That's deglutition. We can see from this picture, this thyroid gland is enclosed within pretracheal fascia. And this pretracheal fascia is connected to the laryngeal cartilages. Especially, it is connected to the cricoid cartilage by a thickening of pretracheal fascia, which is called as ligament of Berry. So this ligament of Berry, which is very important, connects the thyroid gland to the cricoid cartilage. So when larynx moves to close the airway while swallowing, thyroid gland will also move along with it. This is the reason for the movement of thyroid gland during swallowing. And one more clinically important point which you should remember even from exam point of view, that just behind cricoid cartilage is recurrent laryngeal nerve, which supplies all the muscles of the larynx except cricothyroid. So during thyroidectomy surgeries, care should be taken not to injure recurrent laryngeal nerve, which can lead to hoarseness. So now to summarize, how do you differentiate thyroglossal cyst from thyroid swelling? Thyroid swelling. Very simple. Thyroglossal cyst, mainly seen in young children. It is cystic and it lies somewhere at the level of hyoid bone or slightly below hyoid bone, but very characteristic is it moves during movement of the tongue, that is protrusion of tongue. It moves and also during swallowing. Whereas thyroid swellings will move only while a patient is asked to swallow, that is only during swallowing. If there is any other swelling, maybe because of some lymph node, then it will not move. This is how you differentiate the three types of swellings. And then we come to the second part in midline structure clinical correlation, that is tracheostomy. Now, where to do tracheostomy? The first thing is midline. Where in the midline? It's opposite second, third and fourth tracheal rings. Why? Because there are no blood vessels here. You can just retract the strap muscles in this region and you can move the isthmus. So this is the ideal site for tracheostomy. Thank you for watching. Please share your valuable suggestions and also any doubts for further discussions. This is Mars, where medicine meets meaning.